Mark Bertels here again, and just want to years of while I was sick for the last 12 days. I'm not too sure what sick it was, because at the time when I was sick, there was an outbreak of coronavirus, and everybody was sick. You could see, read on the newspaper, people who were sick with coronavirus. Also here there were deaths also during that week, and especially in the NCD or Port Moresby. That's where the concentration of these infections of the pandemic. Yeah, so I was sick for that period of time, and I'm not too sure whether, because I have not gone to the hospital to really get tested. I was actually afraid. One. Two is, I hear then also that many people went to the hospital, whether general hospital or private hospital. People were turned away, not really turned away from the service, but were referred to other medical hospital where they have the facilities for testing for coronavirus, and even some were with very serious respiratory or breathing issues. But they have to send them to go to certain areas to get tested for coronavirus. And so it was like people were pushed here and there. And if you go to the general hospital, that's where the majority of the public go to, it's a long queue, that's one. And two, it appears the service was not very good, because it looks like there is hardly any officers to attend to the public. So the public has to either stand on the queue, wait there for a long, long time. I think many of them were turned away, that there's nobody now at the hospital to attend to you. So it looked like medical officers were also in fear of their own lives. And so it looks like many of them did not either attend work, or if they did, but they were afraid of being infected. So they refused to see, I think, a lot of people. Yeah, so that got me afraid as well, because I don't want to go and sit there or not to be attended to. So I didn't bother going to the hospital. So I have not been officially tested. According to the medical reports and information that were given out, the symptoms that I had were all similar. Most of it was similar to those that of coronavirus, as per the information. And so I was, because I had this short breath, and my respiratory system was also affected, infected, and it got that came there, where it got infected, inflamed, or something like that. I'm not too sure whether it is. And some also said that there at the same time too there was this outbreak on dengue fever. Because prior to that there were some officers who were sick too. Some people I know were sick. Some were sick at the time, just before I got sick. And even after the 14 days when I recovered, I went to the office and I heard that there were some number of officers who were also down at the same time. I think about 4. And I said, well, none of you came to visit me to see as an officer of the organization to come and see me and see how I am. I said, and so I lost contact with you guys, and I don't know who else was sick. Yeah, but I learned there were a number of officers also who were sick and did not go to work. And until that time when I went to work, some people also went to work. Yeah, so I'm not too sure whether it's coronavirus, but I thought it was, or whether it's dengue fever.
This is slower.
It's not hot now. Start from up and down, up and down. No, not hot.
Ikutin the video. Mantap.
What are you doing? It's already not cutting.
Got the video.
Yes.
Full session.
Yeah, yeah.
Where?
Huh? Get. Gwen, you wake up. You need to sleep, you'll continue to sleep. Wake up. People are really weak, and all this, when sickness comes, you are very, very sick. Wake up. Who are you?
Yeah, after steam bathing, I'm now drinking the neem tree liquid that was boiled with the leaves, and I steam bath with it. Actually, yeah, I steam myself, hot air and steam. Then after that, I was bathed, warm water from that, and then now I'm drinking drinking the liquid. I got this cough. You can hear my voice, and it makes my head pain and my body aching. Really sour, right? Now I feel a little bit okay. I think as soon as I regather my strength, I can do some work. Still feeling sick, feeling ill.
Daddy's back is really paining. He was sick for 3 days. His shoulder was back and he was back.
I've been sick a week now, since Monday last week. Yeah, today is Monday, so it's 7 days now. And the sick that I have is a cough, headache, like fever, a headache which causes you to be tired. At the same time, you have this itchy throat where you will cough and cough, and I think if it's a cough, it's now ready. So when I cough, I have this thick mucus, yellowish one, spit it off, and it causes my throat to be itchy. And I have to keep coughing. It's like whooping cough as well. I keep coughing till it cracks. So when it cracks, you have that ease of itchiness, gone. Then after that, you have that feeling again, and it causes you to continue to cough. You can hear the cracking noise. It's like my lung is full of mucus, and as a result, it causes me to have short wind. And for air, I struggle to get air. This is very scary too, because it's now resembles that of coronavirus as we hear. Yeah, the cough more or less affect your air tracts and causes you to pant, short breath. Yeah, so it's quite scary, Sometimes I'm thinking whether this is coronavirus, and when I have this short breath, I'm thinking, when is it going to be my last time to be taking my breath? Yeah, so it's pretty bad. I get better in between. I go and do some work, and then I have this slight headache again, which causes me to, have fatigue and tired. Then I come back and sleep and rest, and then until I feel okay too, and then I go work, and so that's what has been going on, for the last 7 days. I steam myself with some herbal medicines, and I actually drink some herbal medicines too, especially when I feel that I'm having short breaths. I know certain herbal medicines we tested over time, not only myself but on other people as well, and it has worked, very, very effective. Like if I'm having a short breath, and when I take on my breath, and you can hear those whistling sound of my my air tracts being blocked or infected. Yeah, so when I take those herbal medicines, it automatically clears it, like within less than 5 minutes. It clears out that, and my breathing, it stabilizes my breathing become normal, and that's how I've been healing myself at home. Yeah, but I do get steamed. That's my sickness now. I've been here for 7 days now. Oh. So it's 7, 8 days now. The sick that I hear that is going around in the city and in the community is you have headache, then you have like fever, something like malaria as well, sometimes hot body, yeah, so it's fever, and then cough, body aches, joints and the back, the shoulders, all paining, as I speak, I still have this headache. The headache is the one that causes me to be tired, the cough as well. The problem with the cough is, it's itchy throat. I try not to cough, because when you cough, it's going to cause you to continue coughing, because when you cough and it cracks, then that itchiness is released, and at least you can have better feelings. But if it doesn't crack, then the itchiness appears to be still there, and you will continue coughing and coughing and coughing. And, continue coughing, doesn't make you feel good. And as well, sometimes, you have short breaths. I think the short breath is caused, have so much mucus in your lung. Because so when you try to get air, your lung more or less is already filled with mucus. There's not enough space left for the air to come. And so while you try and you want to get more air, not enough space already. And so that causes that short breath. So, you have to get air, from, in a more faster way, so that, trying to make you feel satisfied. As a result, it causes you to take on short breaths. And that's what short breath comes in. Yeah, and then you struggle. You will feel your diaphragm paining, because you feel bad that, it's like you're almost running out of air, and you can't just get enough air. And that is scary too, because then that resembles signs of coronavirus, which they said what affect our lung and our air tracts. Maybe it's either swelling or infection, a bad feeling. So now you can hear my voice, and when I cough today, you can hear, oh, that itchiness is there. But the problem is I continue coughing. So now my head is aching, body ache, and I've been steaming myself for the last week, and I drink herbal medicines. There's no hospital. All hospitals are closed, even private hospitals. Doctors and nurses are so scared of coronavirus. And when you go to the hospital, they will send you around to get tested for coronavirus. And if your situation is worse, you're going to die in between, moving around trying to get tested. And so the medical support is not there right now. Everybody is so scared and so afraid of they're taking precautions of their safety, and so that allows now to leave the patients, to suffer on their own. And I think that's where a lot of people, if there are people who have died, I think they died of that, struggling. So I don't intend to go to the hospital, and that's why I have to be smart. Over time, since I have been getting sick, especially with cough, and which causes me to have short breath, I've tried a number of herbal medicines, and I came across some of them that are very, very effective. If I'm having a short breath and I drink that herbal medicine, it takes like within 3 to 5 minutes, it can stabilize my breathing. Now my breathing it will become normal, and it's like my air tract is open, and if there's any infection, the infection is healed, and so I can now take normal breaths, and I can take in as much air as I want that will fill my lung to make me feel satisfied. Yeah, so it does help. And so I know the power of certain herbal medicines. And those are the ones that I'm using, I'm taking. So I don't intend to go to the hospital, because I know when I go to the hospital, I'm probably going to die there. So I stay at home, and I suffer slowly here, but I relax. And I think one very important thing is your mental belief and healing powers. Like yesterday, I was continuously coughing whole day. Whole day I was coughing, and then I developed these feelings. I didn't actually have the short breath, but I could feel the feeling of short breath, and causes me to be panting for air. And it got me to the point where I got scared. I got scared, and I was thinking like, wow. When it says I was just waiting, when would it be my last breath to take, and I'll be gone? Or I was just looking forward to trying to understand. As I was panting for air, struggling to breathe, I was thinking to experience a worst case scenario where my breathing will become really, really affected. Which means bring me closer to death. So I was looking forward to that, when is it going to be very critical? But anyway, while I was thinking about that, negative thoughts probably, I mean, to me, I took it as a joke. I just wanted to also experience, worst case scenario. But right in deep in my mind, in my heart, in my spirit, my soul, I know it. Even I'm really panting for air, and if it's really serious, I know I'm not going to die. I don't intend to sell myself short. Yeah, but I wanted to experience so that I know how it feels, and then that becomes my strength as well. If I know how it feels, and if I can know how to maneuver it, how to treat it, by my own mental strength, thoughts, thinking, and even including my herbal medicine that I take, then I know I have the power to heal it. I've got the strength. Yeah, so that's, but otherwise, yeah, it got me to that point to where, I was just, so this is eighth day now, and I tell you, it's still strong. And last night, my daughter and I slept here, because I was having this short breath. I drank my herbal medicine, and it stabilized that feeling. The feeling was eased. I could feel I was relaxed. So I slept here, and my daughter came and slept next to me, and we went to sleep on our veranda here. Now I had to take one more. There's 2 herbal medicine that I'm taking. So now I will have to. This morning I have to take one more. The other I don't have it around here, so I'm gonna go and look for it and come and put it here just in case. That one is very, very powerful. I tested it. It works within 3 to 5 minutes. It works. Even if you are having really, really short breath and you are really panting, and struggling, it can stabilize your breathing within 3 to 5 minutes, and you will now stabilize your breathing. That this short breath will disappear, and now you can feel comfortable. When you draw in the air, you can take it all the way in, as much as you want, and you will be so satisfied. So that's the one that I've been taking, and I know it works, and it really works. All right, so stay tuned to learn more about the sick that I have today. Is more or less similar to coronavirus. I don't know, but yeah, I'll tell you more how it feels. The pains that I have, the coughing that I have, the headaches, and the dizziness that I have, all those, the fatigue that I have. I'll tell you guys more, and then at least it gives you some experience, some understanding, some knowledge, some information, and what to do, so that you don't panic, and then you can also help to stabilize your breathing, so that your breathing is normal, and as well as to give you some mental strength, mental power, that you can be the healer for yourself. I've got a backache, and normally I get my daughter to come and walk on my back. I put one leg on my back. Now I went out. I went and bought some things at town, hardware, the store. I came back. Now I'm really tired, so I'm going to sleep again. Oh, my back is paining.
Daddy will steam.
Yeah, I'm going to steam. Hey, go.
That's hot. He's got to wait until he gets hot. His body like sweating. You're going to see later. if he's sweating, yeah, he's sick, very sick, and he's swimming. He's already sweating. Daddy, how many weeks you were sick?
Now 1 week.
1 week. And then sick will finish.
8 days now.
Coronavirus COVID-19.
Really sweating.
This one red mark. It should be more. What is sweating?
Well, as you have known through this video, I have been sick since Monday, the 22nd of March 2021. And so since that Monday up to Monday, that's 7 days. Now it's weekend, it's Friday today. So to date now is the 2nd of April. I've been sick for 12 days now. Today is the 12th day. You know, the feeling I have, as I explained in the video, it resembles the coronavirus. Of course, coronavirus is rampant in my country. And since this year, 2021, and especially in the last, let's say 2 months, so actually from January, February, it's March now, April, you know, the coronavirus pandemic has, you know, became more serious, more obvious, and it has affected a lot more people than our situation was as a country last year. So it has gone more bad. Or during this period, this March period, there were more deaths, more infections. So it has become very serious, and we have now not completely locked down, but there is a isolation policy that has been directed by the state of emergency controller. So the schools have closed. It's now the 2nd week now since the schools are closed. Majority of the schools are closed, from community schools to high schools. I think only big institutions like colleges and universities, some are open. Like the universities are open. Well, as far as I know, University of Papua New Guinea is still open for classes all of these 2 weeks. But all the other schools, they have closed. Offices, I don't think they have been closed, but they have scaled down on their timing and the number of people going to work. So that is scaled down. Now there's a restriction of meetings. There is no social gathering. There's no meetings of large number, as I think 10 or more, or 5 or more. Yeah, so that has really affected the country as a whole. And for me, I don't know. You know, I took my 10 days leave. The purpose of getting my 10 days leave was to attend to my private work at home, to build my house, to complete certain work that I was doing. It just happened that, unfortunately, that the 10 days that I have got this compassionate leave, I got stricken by the symptoms that I have seen and experienced, especially the symptoms that has been given out by authorities. It is all the same. So I think I really got coronavirus. I am supposed to resume office work on Tuesday next week, and I still have not accomplished, you know, my compassionate leave for its intended purpose. Yeah, but it's the 12th day now that I've been sick, and I still have a cough. The headache has now subsided, so it's a little bit okay now. But it's just, you know, I still do feel tired. You know, fatigue is one, and just general tiredness. You know, that's what I've been having. And I noted the tiredness comes from, you know, if I have experienced short breaths and headache, then I experienced this tiredness. So I think it makes sense. The short breath now causes lack of or insufficient oxygen within my system, within my blood, so it's not giving oxygen and more energy to myself, and I think that's where fatigue comes in, and I feel weak and tired. So, I've been resting, sleeping, and I think you can tell from my voice. And I don't know, maybe my facial look, I may look gaunt, and, I'll probably have lost some weight. Yeah, besides my bushy beard, I've grown really bushy as well. My understanding as per the information that's provided is there are phases of COVID-19. First and second phase and the third phase so the first and second between the first days to the 8th or 9th day, and the third phase is the 9th day and onwards, which can take up to 15 days, and the third phase is supposed to be the healing phase. The hospital is now more or less in shock as well, the workers, the doctors, and so not many people are at work. I think they also fear for their lives as well. Every individual patient that goes there, they are all being referred to and from, to go for further medical checks for the coronavirus, and some with very serious situations, especially the asthmatic patients who have natural asthma. This COVID-19 makes it worse because then it affects your lung and your breathing. And now, with the asthmatic patient, it becomes very, very difficult. And I can relate to that because I am an asthmatic patient myself as well. I tell you, it's very, very hard. And I realize you can die. It is possible to die if you are an asthmatic patient. And so that's what happened, during my sick period in the first 8-9 days, I could experience the short breath, difficulty in breathing, which then gives me fatigue, tiredness, and as well as having pains on my ribs and my chest. But otherwise, I didn't go to the hospital. I've been just staying at home, steaming myself, as you can see in the videos, with steam, with this neem tree leaves soaked into the hot boiled water, and the steam that rises from it. I cover myself with bedsheet or cover, and I steam myself. So I inhale the steam, the smell that comes from the neem tree as well, and then as well as drink the neem tree leaf liquid. So those are the only medicine that I've been getting, herbal medicine, and I have not got any medication. So yeah, but otherwise, it's you will have cough. The symptoms is more like a malaria, and then you will have a headache, and then body aches as well, joint aches. That's another big one. Yeah, you will feel the body pains, all over. So I had the body pains, on my shoulder and my back, and then I even had to get my children to stand on my back to push on. Even my when after steaming, I get them to steam bath me as well with warm water, and to press down on all those aching parts of my body. Yeah, but then you have this cough. Yeah, so but anyway, I feel now I'm better. I think I'm healed. I'm healed now. I will still continue to drink my herbal medicine and probably steam myself for this weekend. I also lost my taste of food, so I had to buy other types of food to eat. It gives me that sort of other taste, apart from the normal food that I've been eating. So I thought I can feel that I'm better. I've recovered. So looking forward to to getting back to normal life, and when I resume work next week, probably Thursday most likely. Spread the instruction from the state of emergency controller. The schools will be closed for 4 weeks, so that's 1 month. So now 2 weeks gone already. We have another two more weeks to go, and then after that there's going to be probably another 2 weeks again, just to see. So it might be extended for another 2 weeks. It depends on the cases that we have, the outbreak, the patients that we do have, the deaths, number of deaths that we have in the last, let's say, 2 weeks, or this 4 weeks, and we'll see, and they will assess and advise from there on. It's not a good thing. Just really affect work, flow of work and business, and as well as lives of individuals. Yeah, and private work as well. Yeah. So anyway, I think I'm better. But anyway, so I will post this, and anybody who is in the same category as I am, if you have had it already and you passed through that and you are well, congratulations and good luck. If you are still down, I think my word of advice that I would give is, of course, it is tough. You can feel seriousness, especially when your breathing is affected, your lung is affected. And because I have experienced that sometime back already also, so I take some control. And I think that's one of the messages that I want to give. Have confidence. Even you are panting for air, and I think you still have to control. Have confidence in your mind, in your mental system, that things will improve. Positive thinking alone, versus the actual thing, is not enough. And I think my advice would be that you must at least take something. You must at least take something as a remedy, and that will now give you the courage, the confidence to boost your positive thinking. If you only have positive thinking, but if you are not taking anything, your positive thinking will not rest on anything. So while it is a positive thinking in your mind, in your mental system, but knowing in real that you have not taken anything to base your positive thinking on, I can tell you, your positive thinking will be just floating, and it's going to give you a lot more challenge, whether to really believe that you will be okay or not, because there's nothing that you have taken in reality to empower that positive thinking, so that you can really trust and believe that whatever that you have taken will now work boosted by your positive thinking. So I think that's another thing, and that's where I think I would say some medicinal herbs would be good. Otherwise, if you take in some sort of tablets, I don't know whether amoxicillin would do. I'm not too sure, but take anything that will become the booster for your confidence. For me, since I'm an asthmatic person myself before, I know what sort of herbal medicine that I can take, and each of those herbal medicine that I have taken over those periods of time, as I take, I assess, I study, and so I know the strengths of all the herbal medicine that I have taken. I know their strength. I know my study of healing during my sickness, during those times when I took those herbal medicines. I give it time and I study it, and I know how strong some of them are, how long it takes from the time I've been having problems and the time I took it, and then I assess myself through the stages by time to see whether my problem has somehow subsided and eased. And like if I'm running out of air and I'm panting, when I take those whatever herbal medicine, then I time it. I see, whether my breathing is now been stabilized. So I've taken a number of herbal medicines, and I know their strengths. So during this time, when I know that I am now panting for air, that my breathing, my respiratory system is affected by this so-called disease, and when I'm panting, when I'm struggling, I take on those herbal medications, and those ones that I know they are strong, I run for those. I take them, and because I know their power, already, it become a booster for my confidence, and that's where my positive thinking now is built upon. It empowers my positive thinking. So I do not just think positive. I think positive because I did take something, and that's something I know for sure it will work, or it does work. Take on two herbal medicines. There are two of them, and I know their power. One of them is very, very powerful. Even if you are really struggling with breathing, you find that you are not breathing enough, you find that you are running out of air, or you find that your lung is full, and when you pull in your air, you cannot take in anymore, and so you struggle. I tell you, it takes about less than 5 minutes, and your breathing will stabilize now. And now you can pull in your oxygen, your air with ease, and you don't have pains on your chest. And so you can now find that you will breathe in easily, and when you breathe in, you'll find that your lung is okay, it's not full, and you already got enough air. You can feel it that you have enough air already in you. And so there are two of them, and they are the ones that I take during this time, because I hear so many. I even read in the newspaper. Like last week, it was reported in the newspaper there were 11 deaths. And all this time I'm sleeping, I'm thinking, yeah. So it's very scary. But then I rely on those herbal medicine which I have already tested, and they are the ones who boost my confidence level. When I take them, I know for certain I'm going to be better. And that's now the positive thinking. I am going to be better, but going to be better because of something that I knew already. I know their strengths, I know their powers. And so that's my advice to you. You should, if you are especially an asthmatic patient, you should have already trialed a number of, even the medication that we buy from the shops, pharmacies. You can try all those ones, and get to know their strengths. So in these times here, you probably don't need to go to the doctor to get prescribed, because you'll be running around wasting your time, following the doctors, and doctors are not also at work. They're all afraid of their own lives, and so rather than going there and queuing up to meet your death, go straight to the pharmacy and buy that medicine, because you already know it works. Yeah, so that's my advice. If you have been new and you are now experiencing this short breath, well, that's a risk that you're going to take. But I think call upon guys who have some experience. I'm one of them. Just call upon, and we'll give you some advice. But it's not guaranteed. So because I'm not a professional medical doctor, I cannot guarantee you that. I think at this time too, I may be the wrong person to give such, but I'm just sharing. I'm not telling you to go and do what I've done. I'm sharing to you my story about how I got sick and how I got to heal myself. So I'm now testifying that it's a healable. It can be curable. I think for anybody to take an advice from me and do. By the way, I have not mentioned the names of those herbal medicines, so subjecting you to anything. I think it would be good to share our stories, and where possible we can help each other. I think that's the best we can do. I've heard of people dying while in the queue. I sympathize for them as well. unfortunately, our medical system has more or less collapsed in these days, especially in these last 2 weeks. When we had this outbreak since January, February this year. So now we really have this problem, and I think that's where the personal experiences now comes in. So yeah, I think it would be good to share our stories to one another, and if we can help ourselves, at this time when we really do need this sort of help. Yeah. But otherwise, that's my story, and you can see, like I said, my face. I think I lost so much weight. I didn't weigh myself now. I have to go and weigh. But anyway, I think it's okay too, because I got a big stomach, so I can I can use this capitalize on this sick always. As I sleep on my bed. Actually that's where I sleep here, on the veranda. This is on the veranda. I'm doing my recording on my veranda, and it's a part of my self isolation. I sleep here, but then my small daughter comes and sleeps with me too. Oh yeah, she comes and they stay with me until about midnight, and they go away. They leave me, and I wake up in the middle of the night to find there's nobody. And sometimes I used to think like whether I'm going to wake up. Yeah, because there's so much negativity, and I think that's one problem, and that could be one of the killer means. So much negativity around this sick. I've gone through it, and I got healed. I'm pretty sure I'm healed, and I'll just see how tomorrow is. But I'm pretty sure I'm okay now. I've already regained my strength. So maybe tomorrow I'm going to go to work. Work here. Go and do some physical work and climb around, and you can see that's my area there. That house down there, I'm building that. That's my chicken farm, chicken house. So tomorrow I'm going to be climbing around those trees. Yeah, chicken and ducks. Tomorrow I'm going to be climbing around this rosewood tree there, and this, what's this one?
You can see there's berry.
There's berry here. I'm going to be climbing that, and I cut the branches, and I'm going to pull the canvas. So I'm going to do a lot of physical work tomorrow. And I'm going to also do some cutting. See my veranda here, I'm going to put the fly wire there and the wire. So it becomes my office where I sit down and I do some of my computer work and recording as well, like what I'm doing now. Yeah. So tomorrow is Saturday. Definitely I'm going to be climbing around. I tell you, I'm going to climb around. Yeah, well, actually last night I had a hard time, and I was sleeping here. And I can give. That's my cup of medicine that I was drinking, like herbal stuff.
So last night it got you again?
Yeah, last night I really had this short breath, and I was struggling. So I had to drink this one, and I slept. I woke up at around, I think, 1 o'clock, 2 o'clock in the morning. I drank this one again, then I went to sleep again. Let this sick, disappear, run away from me. Don't try me again, because no. But of course it did. Of course it did. Got me worried. Yeah, worried good. But anyway, I'm okay now. I'm okay. And so now I'm okay. Well, thank you very much for listening. I hope my sharing of, not my sickness, my sharing of the sick that I have had in the last 12 days. I hope that will give you some information and some confidence also how to you can overcome it. All right. So with that, thank you for listening.